Welcome back to the Therapeutics Chronicles. I'm your host, Momin Wali, and today we're tackling one of the most familiar names in every pharmacy, ibuprofen. This non-steroidal anti-inflammatory drug, or NSAID, is stocked in every household, handed out like candy in emergency rooms, and frequently misunderstood in both community and clinical practice. If you're a pharmacy student preparing for the board exams, or a practicing pharmacist who fields daily questions about pain, fever, inflammation, or what to recommend over the counter, this episode is for you. Ibuprofen might seem straightforward, but its risks, dosing nuances, and interaction profile require sharp clinical judgment. As always, before we begin, don't forget to join our WhatsApp and Telegram study communities. We're building a network of pharmacists who study smarter, collaborate better, and grow faster. And if you're on LinkedIn, connect with me there so we can build this professional journey together. Let's start with the basics. How does ibuprofen work? Ibuprofen is a non-selective inhibitor of cyclooxygenase enzymes, COX-1 and COX-2. These enzymes are key in the conversion of arachidonic acid into prostaglandins, which are involved in pain, fever, and inflammation. By inhibiting these pathways, ibuprofen reduces symptoms of pain and inflammation, but it also reduces protective prostaglandins in the stomach and kidneys. That's where its benefits and risks start to diverge. Clinically, ibuprofen is indicated in Canada for mild to moderate pain, muscle pain, dental pain, headache, dysmenorrhea, fever, inflammatory conditions such as arthritis. It's available over the counter in 200 milligram tablets and by prescription in higher doses such as 400, 600, or 800 milligram tablets. It also comes in liquid suspensions for pediatric use and suppository or injectable forms in hospital settings. Let's talk dosing. For adults, the typical dose is 200 to 400 milligrams every 4 to 6 hours as needed, with a maximum of 1,200 milligrams per day for over-the-counter use. Under physician supervision, therapeutic doses can go up to 2,400 to 3,200 milligrams per day, divided into 3 to 4 doses. For children, the dose is weight-based, usually 10 milligrams per kilogram every 6 to 8 hours, with a maximum of 40 milligrams per kilogram per day. Pediatric dosing errors are common, so pharmacists must ensure caregivers understand how to measure and dose properly. Administration tips: take it with food or milk to reduce gastrointestinal irritation. Avoid lying down immediately afterward. For patients using liquid forms, use the correct measuring device, no kitchen spoons. Now, let's walk through the key safety considerations. The biggest concerns with ibuprofen use revolve around the gastrointestinal tract, kidneys, cardiovascular system, and potential interactions. Gastrointestinal risks include dyspepsia, ulcers, and GI bleeding. These risks increase with age, higher doses, prolonged use, or concomitant use with other non-steroidal anti-inflammatory drugs, corticosteroids, or anticoagulants. Patients over 65 or with a history of ulcers should be co-prescribed a PPI for gastroprotection if long-term NSAIDs are needed. Renal risks include decreased renal perfusion and acute kidney injury, especially in patients with dehydration, heart failure, or existing renal impairment. NSAIDs inhibit prostaglandin synthesis, which in turn affects afferent arteriolar dilation in the glomerulus. Add ACE inhibitors and diuretics to the mix, and you have the notorious triple whammy. So, cardiovascular risk increases slightly with long-term use, especially at high doses. NSAIDs can cause fluid retention, increase blood pressure, and may blunt the cardioprotective effects of low-dose aspirin. Now, let's not forget interactions. Ibuprofen may interact with antihypertensives, blunting effect. Lithium, raising serum levels. Warfarin, increased bleeding risk. Methotrexate, reduced clearance. A common misconception? That ibuprofen can be taken freely alongside aspirin. But when taken together, ibuprofen can interfere with aspirin's antiplatelet activity if taken at the wrong time. The key is spacing. If both must be used, take aspirin at least 30 minutes before or 8 hours after ibuprofen. Let's go through some real-world scenarios pharmacists might encounter. Case 1. A middle-aged man requests over-the-counter ibuprofen for back pain. You check his profile and see he's on ramipril and hydrochlorothiazide. You caution about renal risk and recommend limiting use to a few days with hydration and monitoring. You also flag the risk of triple whammy nephrotoxicity. Case 2. A parent comes in looking for children's ibuprofen for a 2-year-old. She's using a kitchen teaspoon to measure. You explain proper dosing by weight, recommend a calibrated syringe, and confirm she's using the correct formulation for age and weight. Case 3. A woman on warfarin buys ibuprofen for menstrual cramps. You counsel her on increased bleeding risk and recommend acetaminophen instead, notifying the prescriber if pain persists or worsens. Case 4. A senior fills a prescription for ibuprofen 600 mg 3 times a day for osteoarthritis. You note they're also taking prednisone and aspirin. You flag the GI bleed risk and call the prescriber, resulting in the addition of a PPI for gastroprotection. Case 5. A patient recently started low-dose aspirin for cardiovascular protection but takes ibuprofen every morning for arthritis. You explain the interaction, counsel on spacing aspirin first, and consider switching to naproxen or a more selective agent if appropriate. Now let's take a moment to talk about university. If you're preparing for pharmacy board exams or just want structured case-based learning with mentorship and peer discussion, university is your home base. And don't forget to jump into our WhatsApp and Telegram groups. Links are in the description. Alright, let's roll into a dream counseling simulation for ibuprofen. Pharmacist. Hi Mr. Davis, I see you're picking up ibuprofen. Let's go over how to use it. You'll take 1 tablet every 4 to 6 hours as needed, preferably with food or milk to reduce stomach upset. Don't exceed 6 tablets or 1,200 milligrams per day unless directed by your doctor. Ibuprofen works by reducing inflammation, pain, and fever. You should feel relief within 30 to 60 minutes after taking it. Some people experience stomach irritation or heartburn. If you notice black stools, stomach pain, or unusual bleeding, stop and seek medical attention. We'll keep an eye on how often you're taking it. If you find yourself using it daily for more than a few days, it's a sign to talk to your doctor. And now, let's lock it in with our rapid-fire board prep Q&A. Question 1. What is the mechanism of action of ibuprofen? Answer: non-selective COX-1 and COX-2 inhibition, reducing prostaglandin synthesis. Question 2. What's the adult over-the-counter maximum daily dose of ibuprofen in Canada? Answer: 1,200 milligrams. Question 3. Why must NSAIDs be used with caution in patients on ACE inhibitors and diuretics? Answer: risk of acute kidney injury due to reduced renal perfusion. Question 4. What can be co-prescribed to reduce GI risk in high-risk NSAIDs users? Answer: a proton pump inhibitor, PPI. Question 5. True or false? Ibuprofen enhances the antiplatelet effect of aspirin. Answer: false. It can interfere with aspirin's antiplatelet effect if not timed properly. And that wraps up our episode on ibuprofen. You've now got the essentials, from mechanisms and monitoring to dosing and danger zones. Don't forget to subscribe and share this with your colleagues and classmates, and as always, catch mistakes before they catch you. This is Momin Wali signing off from the Therapeutics Chronicles.